My name is Dr. Jen Korsa. I'm a naturopathic doctor at Crossroads Naturopathic Clinic. I started back working in fitness actually, and then got really into nutrition, and then started to get more and more interested in different interventions that you could do, and learned a bit about naturopathic medicine, and I got really interested in that because I saw what a difference you could make with just changing a few things in the diet and adding in an exercise plan, and so wanted to do more for people. In my practice, I see a lot of women's health, so specifically a lot of perimenopause and menopause, and I like to see that group because they're not given a lot of options in the regular medical system. Often they're a bit dismissed. Oh, you're fine, or that's normal, or you can take a hormonal birth control pill, but that's the only option they're given. And so I like to see them because we have so many more options we can offer them, from herbal medicine to bioidentical hormone therapy too. In the first visit, so we go through the patient's concerns, anything that they've been dealing with and want to bring up, we'll talk about that first, and then go through all their health history, including family history, as well as diet, lifestyle, any stressors going on in their life at the time. And then we'll go through a plan, whether that's doing some lab testing or specialty testing like hormone testing or sensitivity testing, and then come up with a plan which will include supplements as well as diet interventions and pharmaceuticals if necessary too. They're pretty amazed and grateful to hear that there's other solutions, because a lot of them have been told, oh, this is normal, you just have to get through it. And so they're really relieved to find that someone's listening to them and realizes that these are actually hormone changes that they're going through, and there is something that you can do about it to help them get through all those symptoms. So a patient that I've had before with perimenopause, they have been dismissed before, and so coming in, they're feeling pretty upset about all the symptoms they're going through, and they're questioning why they're having those symptoms. And so just to give them the knowledge that these are changes that a lot of people are going through and they're experiencing the same things, they feel really heard and supported. And then once they know there's things they can do and they try them and they feel a lot better, then they feel like it's quite life-changing for them. Sometimes the treatment can be a lot of steps. However, we just take it one step at a time and go slow and do what they can manage, and we'll eventually get there. Everyone's different, so some people want to go all in and do everything at the same time, and some people want to do one thing at a time, and that's fine. We'll do whatever works for the patient, work it into their lifestyle, and make sure it's something that they can actually achieve so that they feel like they can actually meet their goals and they're not putting too much pressure on themselves to do too much at once. And at this clinic, it's nice because we have the medical clinic next to us, and so they're quite familiar with what we offer, and we do get a lot of referrals from them. One of the treatments that I offer a lot is actually Iron IVs, and so I actually do get a lot of referrals from medical doctors, and I think the more that they learn about us and work with us, or have patients that work with us and with them, and they learn what we do, I feel like we get more and more accepted. And then it's nice that we can just work as a team because we all have the goal of wanting to just help the patient. It should really be a collaborative process. So we offer Iron IVs. In order to get that, you do have to have blood work that shows that you have low ferritin. So ferritin is showing us the storage of iron in the body. So we do need labs that show that you're actually deficient in iron. And then we offer a complimentary iron consult. In that consult, we go through how it all works. Benefits of the IV is it is safe and effective, so it works very quickly. Patients often feel better in 1 to 2 weeks, like their energy levels are up, so they can go from feeling terrible, wanting to just crawl around and stay in bed all day, to having normal energy, being able to get up in the morning, go for a workout, have energy at work, and come home and still have energy for their friends and family. So it can make a really, really big difference. Even the nutrient IVs make a really big difference. Do a lot for immune health. So some patients coming in that get sick 1 or 2 times a month. Maybe their teachers or work in some sort of childcare, and they're just getting sick all the time and they can't seem to kick it. Every time they get sick, they're sick for weeks even. And then get them in for even just a few nutrient IVs, and they're feeling a lot better. We customize nutrient IVs to the patient, so based on what kind of concerns they have, we'll customize a formula to them. And often that makes them feel better very quickly too. Crossroads Clinic, it is a really collaborative clinic. So we all work together, we all help each other, we share knowledge. There's no competition, we're just a team, one team. So we spend a lot of time together. We try to do fun events together so that we're all quite close. And so it does help if you have any kind of tricky case or anything you need help with, you have a whole team of people who will help you. And then we've got a counselor and acupuncturist too, which are great because they are such a good additional treatment that a lot of the patients need on top of the naturopathic treatment. And so it's great to be able to refer to other practitioners here too. If you are tired of feeling tired, you should consider a naturopathic doctor because we will investigate the root cause of your fatigue, and there are lots of things to investigate there, and so we will keep digging until we find the reason, and then lots of treatments we can offer.